Hello! Welcome to another episode of Ask PA Mimi. Get ready, and let's make health make sense. Today, we will be focusing on the topic anxiety and everything you need to know about this condition. Do you constantly feel on edge, even when nothing is wrong? Fear. If your heart races, your mind won't switch off, and sleep feels impossible, then this video is for you. In this video, you will learn what anxiety actually is, why it happens, and how it's diagnosed. We'll also cover breathing techniques that work, nighttime anxiety routines, and treatment based on NICE guidelines. It is worth noting that anxiety is a normal stress response that becomes a problem when it is persistent, excessive, difficult to control, or interferes with daily life. Clinically, anxiety disorders include generalized anxiety disorder GAD, panic disorder, social anxiety disorder, and phobias. Anxiety is your body's fight or flight system being switched on too often. It usually has multiple contributing factors, including biological ones, like an overactive amygdala or a neurotransmitter imbalance. Psychological factors can also contribute, such as trauma, chronic stress, and negative thinking patterns. Environmental factors, like work stress, financial pressure, and relationship difficulties also play a role. Risk factors include a family history of anxiety, childhood trauma, chronic illness, substance misuse, and personality traits, like perfectionism. Psychological symptoms include constant worry, racing thoughts, irritability, and difficulty concentrating. Physical symptoms can manifest as palpitations, sweating, trembling, chest tightness, shortness of breath, and gastrointestinal upset. It is crucial to understand that anxiety is both mental and physical. Anxiety is a clinical diagnosis, but investigations are done to rule out other medical causes. First-line assessment includes a full history, a GAD-7 questionnaire, and basic blood tests. Second-line checks may involve an ECG for chest symptoms or further endocrine tests if red flags appear. Diagnosis is based on a structured clinical assessment using DSM-5 or ICD-11 criteria. It is vital to rule out conditions like hypothyroidism, arrhythmias, and substance-induced anxiety. Let's discuss breathing techniques. SPRU. The first is 4-4-4 for box breathing, which involves inhaling for 4 seconds. Hold breath for 4 seconds, exhale for 4 seconds, and hold breath again for 4 seconds. Repeat these steps for 2 to 3 minutes. PODE. Another technique is the 4-7-8 technique, which entails inhaling for 4 seconds. Hold breath for 7 seconds, and exhale slowly for 8 seconds. Disactivates the parasympathetic nervous system. If you experience anxiety mostly at night, create a routine. No caffeine after 2 p.m. Stop screens 60 minutes before bed, and write down your worries. Also, practice a 5-minute breathing exercise, keep lights dim, and avoid checking the clock repeatedly. This helps manage changes in cortisol rhythm. Management follows the NICE Step Care model. Step 1 is education and active monitoring, including psychoeducation and lifestyle advice. Step 2 involves low-intensity psychological interventions like guided self-help or group CBT. Step 3 involves high-intensity psychological therapy, with individual CBT being the first-line approach. If needed, medication may be prescribed. The first-line treatment is typically an SSRI, like sertraline. Benzodiazepines are avoided for long-term use. Seek urgent help for suicidal thoughts, severe panic attacks with collapse, or unassessed chest pain. Please speak to a GP or mental health professional if you are struggling. In summary, anxiety is common and treatable, but remember to seek medical help if struggling with symptoms. Thank you for listening, and if this video helped you understand anxiety better, like and subscribe for more clear medical explanations made simple. Don't forget to subscribe, comment, and like for more videos.